Before we begin, this story discusses a medical procedure involving graphic physical descriptions, institutional abuse, and the exploitation of psychiatric patients. If that's something you need to step away from, we understand. Take care of yourself first. In December 1949, the Nobel Committee in Stockholm awarded its prize in physiology or medicine to a Portuguese neurologist named Antonio Egas Moniz for inventing a procedure in which a modified icepick was driven through a patient's eye socket and swept back and forth inside their skull. The procedure required no operating room, no anesthesia beyond electroshock, and no informed consent. By the time the prize was awarded, nearly 20,000 Americans had already undergone it. Every story in here actually happened. That's the part that should scare you. This is the Unlit Room. New stories every week. Today, the man who drove across America in a van, lobotomizing patients by the dozen, and the Nobel Prize that was never revoked. Washington, D.C., 1936. George Washington University Hospital, a squat brick building on H Street, where a neurologist named Walter Freeman was about to perform America's first prefrontal lobotomy. Freeman was 40 years old, wore a thin goatee, and had never been trained as a surgeon. His patient was a 63-year-old woman from Kansas named Alice Hood Hammett, who had been institutionalized for agitated depression. The theory behind it was simple enough, brutally simple in fact. By the early 1930s, state psychiatric hospitals in America were overflowing. More than 400,000 patients were institutionalized, many for conditions that had no effective treatment. Depression, schizophrenia, what the medical establishment still called hysteria. Antonio Egas Moniz, a neurologist at the University of Lisbon, proposed a solution. If the prefrontal cortex was responsible for obsessive thoughts and emotional disturbance, then severing its connections to the rest of the brain should stop the cycle. He called the procedure a leucotomy, from the Greek for white and cut, because it targeted the brain's white matter. Moniz performed his first leucotomy in 1935. He drilled 2 small holes in the patient's skull and injected alcohol to destroy prefrontal tissue. Later, he used a wire loop called a leucotome to core out sections of brain matter. Of his first 20 patients, Moniz reported that 7 were cured, 7 improved, and 6 unchanged. Walter Freeman read about Moniz's results and saw something no one else had. Scale. Freeman understood that if you could simplify the procedure, make it fast, make it cheap, make it possible outside an operating room, you could reach the hundreds of thousands of patients rotting in state hospitals across America. It's worth pausing on that number, 400,000 people in American psychiatric institutions by the mid-negative 1930s. Most of them would never leave. The hospitals had no effective treatments, no budget for individualized care, and no public pressure to improve. They were warehouses, and Freeman saw a way to empty them. Micro cliffhanger 1. What he came up with next would make the leucotome look gentle. Freeman's modification was the transorbital lobotomy. Here is how it worked. The patient was rendered unconscious, usually by electroshock. 2 jolts to the temples. Freeman would then lift the patient's eyelid, insert a thin, pointed instrument above the eyeball, and drive it through the thin bone at the top of the eye socket using a surgical mallet. Once the instrument was inside the brain, he would sweep it back and forth in an arc, severing the nerve fibers connecting the prefrontal cortex to the thalamus. The instrument he used was, quite literally, an icepick. He borrowed one from his kitchen drawer for the first procedures. Later, he had a custom version made. He called it a leucotome, but everyone else called it what it was. The entire procedure took under 10 minutes. It could be performed in a doctor's office. It required no surgical training, no operating room, no sterile field. Freeman performed it wearing a suit. And then he went on the road. Freeman bought a van and drove it across the United States, visiting state psychiatric hospitals in 23 states. He called it the Lobotomobile. At each stop, he would perform lobotomies on patient after patient, assembly line style. At one West Virginia state hospital, he lobotomized 25 women in a single day. He sometimes performed the procedure with both hands simultaneously. one ice pick above each eye, because it was faster. It's difficult to describe this without it sounding like fiction. A neurologist with no surgical training, driving a van across the country, performing brain surgery through people's eye sockets in hospital day rooms. But this was standard American medicine in the 1940s and 1950s. It was published in journals. It was celebrated. Micro cliffhanger 2. The question that should keep you up tonight isn't how he did it. It's who he did it to. 60% of lobotomy patients in the United States were women. In Ontario, Canada, between 1948 and 1952, that figure was 74%. The diagnoses that sent them to the operating table, or more accurately to Freeman's office chair, read like a catalogue of inconvenience: depression, anxiety, hysteria, emotional instability. Some women were lobotomized because they were deemed difficult by their husbands or families. Others because they couldn't cope with the expectations placed on them. There were children too. Freeman's youngest patient was 12 years old. Howard Dully was 12 when Freeman drove the leucotomy through his eye sockets in 1960. His stepmother had brought him in because she found him difficult. Freeman's notes described no significant psychiatric illness. Dully survived. He would spend decades in institutions, on the streets, and in prison before finally getting a copy of his own medical records and learning what had been done to him. The results Freeman reported were measured by a specific metric: manageability. Patients who stopped causing problems were counted as successes. Freeman's own clinical notes are revealing. He described one 29-year-old woman post-lobotomy as, and this is a direct quote, a smiling, lazy and satisfactory patient with the personality of an oyster. He meant it as praise. But not everyone agreed on what Freeman was accomplishing. Within the medical community, two views competed, and they weren't subtle about it. Freeman and his supporters framed lobotomy as liberation. Patients were freed from the torment of their own minds. The alternative, they argued, was permanent institutionalization with no hope of release. According to Freeman, the procedure gave patients a second chance, a fresh start. He called it surgically induced childhood. Patients would need to mature again, he said, and this time they would get it right. The opposition saw something different entirely. Critics, including many of Freeman's own colleagues at George Washington University, argued that the procedure didn't cure anything. It destroyed. Patients weren't freed from mental illness. They were stripped of the cognitive and emotional capacity to express it. The medical journal, The Lancet, ran editorials questioning whether the outcomes Freeman reported as successes were distinguishable from brain damage. Both sides had the same evidence. They disagreed on what the word better meant. Micro cliffhanger 3. What the published case studies didn't capture was what happened to these patients in the years that followed. The follow-up data, when it finally came, was devastating. A British study of 300 lobotomy patients found that while some showed reduced agitation, the costs were staggering. Seizures, incontinence, profound emotional blunting, the inability to feel joy, grief, or love, intellectual deterioration severe enough to require lifelong care, and a mortality rate that hovered around 5% during the 1940s, meaning roughly 1 in 20 patients died on the table or shortly after. Many survivors could no longer work, maintain relationships, or care for themselves. They hadn't been cured. They'd been diminished. Families who had been promised relief were now caring for someone who was physically present but psychologically absent. A person who smiled at everything and understood nothing. And Freeman kept going. Between 1936 and 1967, he personally performed or supervised approximately 3,500 lobotomies. Pause. In his unpublished memoir, Walter Freeman described the purpose of the lobotomy in terms that strip away every pretense of healing. He wrote that the goal was, quote, rendering the patient more amenable to the social pressures under which he is supposed to exist. Not curing illness, not relieving suffering, making people easier to manage, making them compliant, making them quiet. And for the invention of this procedure, Freeman's mentor Antonio Egas Moniz was awarded the Nobel Prize in Physiology or Medicine. That was 1949. As of today, 2026, the prize has never been revoked. There's a version of this story where the villain is Walter Freeman, the reckless showman with his lobotomobile and his ice pick. And he was reckless. But the more uncomfortable truth is that Freeman didn't act alone. He operated within a system that valued compliance over humanity, that measured recovery by how little trouble a patient caused, and that rewarded the destruction of human personality with the highest honor science can bestow. The lobotomy wasn't a rogue experiment. It was consensus medicine. It was peer-reviewed. It won a Nobel Prize. That's the part that should keep you up tonight. Not that one man did this, but that the system let him, and then applauded. More stories like this every week. Subscribe if you want the next one to find you. Follow the Unlit Room wherever you listen. Tell a friend who can't sleep. Subscribers hear this one ad-free, plus a bonus ending on Freeman's final years. Full story on the main channel. Follow if you're wide awake. That was the Unlit Room. See you in the dark.